How to manage medications in home stroke care. Managing medications at home after a stroke is a vital part of recovery and preventing future strokes. It involves staying organized, understanding your medications, and working closely with healthcare providers. First, it's important to create a complete list of all medications the person is taking. This includes prescribed drugs, over-the-counter medicines, vitamins, and supplements. Write down the name, dose, how often it's taken, and why it's needed. Keep this list updated and share it with everyone involved in care, including doctors and caregivers. Next, develop a medication schedule or chart. This can be a simple paper chart or a digital reminder system. Mark the times for each medication and stick to this routine daily. Consistency helps prevent missed doses. Using a pill organizer with separate compartments for morning, afternoon, evening, and night can make it easier to keep track. Some organizers even have alarms or electronic alerts to remind you when it's time to take a pill. Education is key. Caregivers and patients should understand what each medication does, possible side effects, and why it's important to take it exactly as prescribed. If the stroke survivor has difficulty communicating or remembering, caregivers should be trained to recognize signs of adverse reactions or missed doses. Regular communication with healthcare providers is essential. Report any side effects, changes in symptoms, or difficulties with medication routines. Pharmacists can review medications to avoid interactions and ensure proper use. Monitoring the effects of medications is also crucial. For example, blood thinners requiring blood tests to check their effectiveness and safety. Keep appointments for these tests and follow up with the healthcare team. If there are barriers to taking medications, such as swallowing problems or financial issues, work with healthcare providers to find solutions. Liquid medicines or simplified regimens can help, and assistance programs may be available for costly prescriptions. Always keep records of any changes in medication, including new prescriptions or dosage adjustments. Share this information with all caregivers and update the medication list. In case of emergencies, or if the primary caregiver is unavailable, provide backup caregivers with clear instructions, the medication list, and contact details for healthcare providers and pharmacies. Incorporating medication times into daily routines, like mealtimes or therapy sessions, can help build consistent habits. Remember, managing medications effectively is a team effort. It supports recovery, reduces the risk of complications, and helps improve quality of life. Always consult healthcare professionals for personalized advice and adjustments. Proper medication management is a cornerstone of safe and effective home stroke care.